Imagine having difficulty performing everyday tasks like drinking out of a glass, eating with utensils, or even writing your own name. These are just some of the struggles that people experience due to essential tremor, which can cause rhythmic trembling of the hands, head, voice, or legs.
And although you may never have heard of it before, essential tremor is the most common movement disorder impacting an estimated 7 to 10 million people in the United States.
So let's meet Jean, who, despite her own diagnosis, encourages others to not hide in the shadows.
Take a look at this.
My symptoms began in my late 40s. And I noticed that my hand would shake when I would write. If I got stressed in any way, I would shake. And I was working as a realtor. It was very difficult because I couldn't write legibly. I went to my primary care physician, who suggested that I go see a neurologist. He diagnosed me as having essential tremors and gave me this anticonvulsant drug. I was not comfortable at all with this drug. The side effects were worse than the tremor itself, but it did help my tremors slightly. And so I proceeded to continue taking it as my tremors became worse. And the neurologist, he would add on more medication. He would increase it. Oh, I had no idea what essential tremor was. The trauma that it can cause in a person's life. There was so much, all the little things that you cannot do, and we take it as just a normal thing to be able to drink a glass of water.
Essential tremor is the most common cause of tremor, impacting 7 times as many people as Parkinson's disease. Although it can start at any age, it is most often diagnosed between the ages of 40 and 50. Dr. Dash Tipor is the director of the Division of Movement Disorders at the Loma Linda University of Medicine.
So the clinical features of essential tremor is involuntary rhythmic movements. Tremors usually are during action, mostly in hands. However, tremors can be in head, torso, legs. Sometimes patients describe it as an internal tremor. Voice tremor is not uncommon at all. It can cause social isolation, social embarrassment in some cases. Is a disease that symptoms can be very bothersome to patients, but is not a life-threatening disease.
There are no medical tests to diagnose essential tremor, so it is often a matter of ruling out other conditions that could be causing symptoms.
Diagnosis of essential tremor is based on clinical history and physical examination. That means you need the good detailed history from the patient that includes when tremor started, the severity of the tremor, and the detailed family history and medication history or medical history of the patient, because all matters. So usually with the good clinical history and good physical examination, you should be able to come up with a diagnosis.
Currently, there has not been a medication created to specifically treat essential tremor, and to date, only a few effective prescription medications are available for treating the symptoms. Unfortunately, it is estimated that less than 60% of people with ET are helped by these medications.
I found out that the International Essential Tremor Foundation was doing an informative meeting. I found out from the doctor who was there that I was taking twice the amount of anticonvulsive that I should have been taking. This movement disorder neurologist was a saving grace to me. He tweaked my medications, and I was able to control myself more easily. But as time went on, I got worse and worse.
There are multiple treatment modalities for essential tremor. Currently, we use some medications that are not necessarily based on mechanism of the disease as far as we know. Currently, we use some anticonvulsants such as primidone. We use beta blockers such as propranolol. Surgical modality is another alternative the patient they have. One of the most recent one is using ultrasound under MRI, and the result is instantaneous and there is no incision involved. Not every patient will be qualified for this type of procedure. Deep brain stimulation is being done for several decades. One of the big advantages of deep brain stimulation is reversibility. If the patient doesn't like it, you can turn it off. Disadvantage would be side effect after DBS surgery, such as a patient always has the wire in their body and something like a pacemaker under their chest, and wire goes to the brain, and that can cause, in some cases, rare conditions, can cause infection or even bleeding or breaking the wire.
2.5 years ago, I had deep brain stimulation, and I fought it for many, many years. I was at the point where I really felt I had to do it. I like to crochet. I like to do things. Never would I have been able to do it. Even though I have had deep brain stimulation, I am getting worse, and my shaking is getting worse.
Yeah, so one of the challenges that we have right now is medications that we are using are not targeting exactly per mechanism of essential tremor. The good news is there are multiple treatment modalities in pipeline. So therefore, we are getting better and better understanding about mechanism of the disease. And when we know that, then we have a better treatment options.
One such investigational medication developed with essential tremor in mind is ulixacaltamide. The phase 2 study, called the Essential 1 study, assessed the safety, tolerability, and efficacy of ulixacaltamide against a placebo in essential tremor patients. According to the findings, participants who received treatments with ulixacaltamide showed improvement in the modified activities of daily living score relative to the placebo. While the results were numerically different, they were not statistically significant as analyzed. The Essential 1 results highlight the potential of ulixacaltamide to transform the treatment of essential tremor. If successful, this medication would be a significant advancement in the treatment of ET, and it would be the first medication ever developed specifically for essential tremor. If approved, it would be the first medication for essential tremor in more than 50 years.
My recommendation to everyone is find an essential tremor support group. You will be with people that have the same condition you do, and you'll find out you're really not so different.
There's no question about it that the support group meetings are absolutely essential for the people that are the caregivers. You realize that just like with the essential tremor patients, knowing that they're not alone, we know we're not alone either.
Special thanks goes out to Jean and John for sharing their story. I am really sure that it's going to help so many others out there with essential tremor.
Absolutely. And like Jean said today, you do not have to suffer silently. There is support available. If you'd like more information, you can visit essentialtremor.org or go to our website, thebalancingAct.com.